Hi guys, it's Brooke here. I have a super quick favor to ask. When you have a moment, please take just a second to give this podcast a 5-star review. This will help me to continue the podcast and continue to bring these resources to the community. Thank you so much for that 5-star review.
I used to have double vision. It's how I got into optometry school, that I saw double for the first 17 years of my life before my basketball coach said, something's not quite right. You're trapping the ball. And, there was, I'd fall out of bounds and because I could see two lines. I didn't know where the lines were on the court. What these kids are doing all the time, they're fighting their vision because their vision isn't giving them correct information.
Hey there, it's Brooke, and welcome to Finding Hope on the Spectrum, where I have heart-to-heart conversations with parents, professionals, and autistic individuals sharing personal insight and life experiences. Together, we dive deep into supports, programs, and stories that offer inspiration, insight, and most importantly, hope for the neurodiverse community. Before we begin with today's topic, please take a moment to like, share, and subscribe to this podcast. And if you know someone who this would be helpful for, please pass it along. Remember to always stay curious, be kind, and have an open heart.
All right. I am so excited about today. Welcome back to Finding Hope on the Spectrum. And today's guest is Dr. Susan Daniel. She's an expert in autism and vision therapy who is doing truly groundbreaking work with non-speaking individuals and spellers. And Dr. Daniel has dedicated her career to understanding the connection between vision, motor challenges like apraxia, and communication. And through her work, she's found that many non-speaking individuals, especially those who communicate through spelling, are also navigating significant vision challenges that can impact their ability to access communication. And she now leads a unique parent-driven model of care that combines vision therapy, coaching, and empowerment, helping families support their children in a way that's both effective and sustainable. And her approach not only improves visual function, but also dramatically impacts a person's ability to communicate more efficiently and confidently. And what a gift she's offering to these clients. I'm so excited to have Dr. Daniels on. And she also is training other doctors, which is fantastic, and expanding access to this work across the country and around the world. So I am so excited to dive into this story and learn more. I learned so much even when we met before today. And so welcome, Dr. Daniel.
Thank you for inviting me. I'm so glad to be here.
Fantastic. Well, you have so much to share, so we're going to get right into it. Let's just start with talking about the beginning. I'm always curious of what brought people to the careers that they're in and what drew you to this work and with autism and vision therapy.
Well, I was a general optometrist for about 10 years, working with glasses and contact lenses and eye health exams. And then I had my second child, Matthew, who was diagnosed with autism at about a year old. And through his therapies, the OT and PT and speech therapy, we had his therapies at the hospital. And they found out I was an eye doctor, and so they asked me a lot of eye questions about their patients. And a lot of them I didn't know the answer because that developmental sequence of vision wasn't really taught in optometry school 35 years ago. It's taught more now, which is good. And so I decided, there was nobody in our area that specialized in kids that were autistic or had CP, Down syndrome, or other special needs. And I decided that was going to be me. And I did a lot of research and shadowing with other doctors from around the world, and the internet was my friend. And so we learned lots of techniques at conferences and that kind of thing. And over the course of my career, my patients are the ones that have taught me the most. And I would say the number one patient that's taught me the most has been my son. He has very complex visual issues and apraxia. He's non-speaking. And I've learned through the other therapist and him, but it was always, as a parent of a special needs kid, you are a detective. You're trying to figure out what they need, if they're hurting, what they're asking of you in a nonverbal way. And then also figuring out why is he doing what he's doing? When he didn't walk until he was about 4 years old because he had severe apraxia and severe vision problems. He had difficulty with his depth perception and where is his body in space. And so he crawled up until 4 years old. He didn't even crawl until he was 2. And so when he did get up from the floor, even though he didn't have any physical problems with his legs or his arms or his core, he would just take one step and then touch the ground and then take another step and touch the ground because he didn't know where the ground was and compared to his body. And so I had to learn all about what to do with that. And that kind of got me into this field. And it's been a great journey, and I'm continually learning and trying to share the experiences from what parents have taught me and what the spellers have taught me. And it's just been remarkable. It's been a great time in my career.
Amazing. And you certainly have. You are just on this journey of growing and learning and evolving. You've evolved a lot even since I've seen you last, which was many years ago. And I learned so much about what you're doing today, and I'm excited to have you share about that. And I just love that you're on this journey of continuing to be open and to learn and to adjust your support for the need that's out there. And this is a big one. So, and I'd love to have you share kind of how your understanding of autism and apraxia. I think apraxia, at least for me, in my space, we've learned so much more about apraxia through spellers. And people are talking about it more and understanding it more. It used to just be kind of a speech therapist that I would hear about apraxia from, but now I feel like people are talking about it more. And I'd love to have you share just a little bit about how that has evolved, especially as it relates to vision.
Mm-hmm. Well, and like you, I learned about verbal apraxia because my son is non-speaking, and he's had some really great speech therapists over the years who have taught him different modes of communication. And we always knew that he understood what we were talking about, but he didn't have the motor skills and that, mouth motor skills to get out and express what he wants to say. And over the years, he had some few words, and he, through his OT, learned to write a few words, but just never really communicated that way, in depth of what he's actually thinking and wanting and desires, that kind of thing. But it wasn't till a few years ago, I was working with a woman named Dawn Marie Gavin, who was trained in speech spelling to communicate. And I had done some vision therapy for her son. And that's where I learned a little bit about this communication method. And a few years ago, she started coming to the eye examinations, wanting to know how the vision impacts the spelling. And so what we did is she would come in and spell with her clients in front of me. I would make the observations, then do the evaluation, looking at all the visual skills, how they use their eyes to guide their motor movements, and then give suggestions back to her of what type of letterboard would be best for him because of how their eyes work together as a team, where to place it, what size of letter, all of those things. And that's been a really great collaboration. So I had sold my practice that I had for 30 years, and I started a new practice that was specifically for those who are non-speaking, and using all different modes of communication, not just a letterboard, but also a keyboard, an iPad, a laminate board, all of those things. And that's kind of how I got into the spelling.
Yeah, amazing. What a journey, and what a gift for you and Dawn Marie to come together to help those clients. That is a really unique offering that you were able to do together. And, that's fantastic. And I love that this is what you're focusing on now. And for those that they don't understand what vision therapy is, let's start with talking just a little bit about what vision therapy is. Very different than an eye exam, a traditional, eye exam where you're looking at your vision from a distance or close up or whatever it may be. So why don't we differentiate that to begin, and then we can talk about what you're doing specifically.
Okay. Yeah. So with the general eye exam, which is what I had done for the first 10 years of my career, is first to see how clear they see. Are they seeing blurry in the distance, blurry up close? Are they nearsighted or farsighted, have astigmatism? Those are the main categories of refractive errors, and be able to correct that with glasses or contact lenses. Now, contacts are a little difficult for those who have apraxia, and not only just the physical part of putting something in the eye, but it's kind of scary, getting close to the eyes, for these kids and for a lot of people in general. But also from a sensory perspective of wearing glasses. And so it was a little bit of a challenge when I saw these patients before I really had my son and knew more about it. We'd prescribe the glasses and say, good luck, to the parent. Now I have a whole process of how to get used to the sensory feel of the glasses. That has been pretty successful. But then we check for, in our general exam, the eye health, making sure that their eyes, they don't have cataracts or retinal problems or corneal problems or allergies. And what I found in this particular population is that in those categories, the rate of eye ocular disease is much higher than the average population. And you wouldn't think so. You would think, that it should be the same. But what we find is that a lot of kids that are non-speaking and autistic may have a lot of other medical issues, gut issues, seizures, that kind of thing. Some of the medications can cause vision problems, ocular disease problems. Say they have seizure medication, it can affect certain ones, affect the central vision to where that issue can be affected. If they hit their head, they can have cataracts or a retinal detachment. And unfortunately, I see that often. If they have Down syndrome, cataracts kind of go with Down syndrome. And so that can impair vision, and eye rubbing and eye poking. Sometimes that starts I have allergies, so I'm rubbing my eyes, but then it becomes a stim, and then they rub their eyes more, and then it can cause corneal problems, or what we call keratitis. So I found that in this population, the ocular disease is a lot higher. And that's usually, they do in a general exam some screening of how the eyes move and how the eyes work together as a team. But then there was not really anything that they did for that. Some of the doctors, we referred to a developmental optometrist who would do more extensive testing. And that's what I did when I was a general optometrist. But I didn't really know what they could do. I just know, make the referral and see what they do. And I never really saw the results. But a developmental optometry exam does that first part and then adds more to it, because a developmental optometrist goes through extra training and, can get a fellowship and become board certified in vision therapy. And what they look at is what is normal development from birth on through, when you're in your career. At what stage should each eye movement develop, and then how the eyes coordinate together as a team, how it relates to what the body is doing. So if the body can't cross midline with their body, they're going to have difficulty with crossing midline with their eyes. If one side of their body is really strong and the other side is weaker, they're going to have one eye that's stronger and one eye that's weaker. It all connects with the whole body. Now with apraxia, global apraxia is when they know exactly what they want to say, what they want to do, but their body doesn't do what they're asking it. So they're saying, I really want to pick up that glass of water, and that's across the way. They have to motor plan that whole sequence to get their body to start moving, and then locate visually where the glass of water is, and grab it, and then be able to take a drink from it. So many steps to it. They know exactly what the steps are. It's just that they're getting their body to do that is difficult. And that's kind of what whole body apraxia is. Well, you can imagine the motor planning of the eyes is even more complex, because not only do they have to know where their body is in space to be able to locate where it is that I'm looking at, because if you don't know where your body's in space and you're all over the place, locating, like, where is this pin in front of me? I don't know where it is. I can get a general idea where it is, but I'm not looking right at it. You see a lot of these kids that they're listening to you, their body is moving, but they're not looking at you. Part of it is that they're still figuring out where their body is in space. Then once they are able to look at the target, then they have to figure out the depth. Where is it in relation to me? Then once they get that, they have to say, what is that? And identify. That's that discrimination. And then the last part of vision is, what do I know about that object and how does it relate to things around us? So all of those things of where am I? Where is it? What is it? And what do I know about it? That all is what encompasses vision. It's not just clarity of sight. And that's what developmental optometrists are really looking at, is where in the development did they miss a step, or did they stop, hit a brick wall, in their development. And, now they're 15, but their eyes have developed up into a 5-year-old, even though they're super smart and they can do, they're highly intelligent. Their eyes are just not doing what they want it to do. And that's where, as a developmental optometrist, we break down the steps of those vision to where it's not needing a cognitive demand, that it's just moving the eyeballs and finding a way that's interesting enough, because, they'll look at the target and go, yeah, that's the target. It has to be something where they're doing something to make it meaningful for them to actually fixate. And then we do a tracking, an eye jumping exercise, a focusing on, can I make it clear? Can I make it blurry by having control over it myself? And then the most important one is, can the two eyes coordinate and work together as a team? That's a very difficult skill for those with global apraxia. So many of the patients that I see who have verbal apraxia and are showing signs of global apraxia will have double vision. And double vision is very disturbing. I used to have double vision. It's how I got into optometry school. That I saw double for the first 17 years of my life before my basketball coach said, something's not quite right. You're trapping the ball, and, there was, I'd fall out of bounds, and because I could see two lines. I didn't know where the lines were on the court. And I would be able to read, but only for a very short period of time, because then the words would start to double. And that's what these kids are doing all the time. They're fighting their vision because their vision isn't giving them correct information. And so it affects their walking, just like my son tapping the floor, take a step off the floor because his depth perception was off. You can imagine trying to use an iPad to communicate, or writing. When you're seeing double, it's like, where am I and how do I coordinate this? So those skills, no matter how much they're taught, they get frustrated with it. So if we break down the steps of teaching the eyes how to work together as a team, and there's like a zillion types of exercises that are interesting enough to do that do not require a verbal response, then that becomes a strong skill. So then they can concentrate on that communication part. And so vision therapy is quite grand, as far as there's many things that we can work on in vision therapy, from a visual perceptual as well as a visual motor perspective. But in my practice, what I'm working on is specifically, what are those visual and body control issues that we can work on to get them to communicate? As a parent, we want to hear our child's voice so much. And so motivating for us to do the activities that will help train that, because we really want to hear their voice. And their child really wants their voice to be heard as well. That it's scary because it's hard for them, but the desire is there so much that they're willing to push through and try harder things. Once the exercises are broken down into smaller pieces that are doable, and then we start adding them together, kind of like rubbing your belly and tapping your head, that you can do multiple things at the same time. And right now, when you have one thing that's causing a problem, like a double vision, then it's impairing that ability to put all those activities together.
Yeah. Oh, that's fantastic. Well, thank you. That makes so much sense. And I mean, I can't imagine how hard that is to have double vision and then be expected to perform tasks and, and communicate. So, I think this is so important to have this awareness because, it really does, it can impede somebody's ability to learn and to grow and to show their true potential.
Yeah.
And
it makes you nervous. A lot of our kids are very anxious. Going into new environments and new people and just all of that can be a little scary when your vision is just moving. The people that are moving by you are giving you kind of motion sensitivity. And so you tend to just kind of cower into your cell. And we find that when we do work with these visual skills and get them interacting with their world in a controlled environment, and then move it to, okay, now like today I just had a patient that we're like, okay, we've gotten to these steps. Now I want you to go to a restaurant when it's quiet. And then we're going to work on these exercises in our breathing and working on our control of our nervous system while we're doing a visual task. And then the next time maybe come at a little bit busier time and a little bit. So we start with being in a controlled environment in their home and then out in the environment so that it generalizes those skills.
Yeah. Well, I think that's such a great way to scaffold for them to be able to just over time increase the challenge and give them more opportunity for growth in a way that they feel successful and with their parents there too, which is so perfect because, they trust that and they know that their parents are there and they're part of the process. And, I'm sure that gives them some security too, to know that they can be successful in those new challenges with those new challenges.
Well, and that's how, I started to change the model of how I work, for 30 some odd years. The traditional model of therapy is you bring your child to speech therapy. They do their magic. And you bring them home and you try to practice things, but you didn't quite get it because it looked really easy when the therapist did. But when you tried to do it, it wasn't very easy. And so then you're like, well, I'll bring them back for their next session and they'll do their magic. And it's a long process. And then, when COVID hit, we had to change our model a little bit because we had to do some things online. And we found directly working with the child or the young adult patient, we found that didn't work as well because they're like, where are you? Trying to pretend, focus on the computer was not really their thing for most of the challenge. But when we're coaching the parent, how to do the activity with their kid, where the kid is in their happy environment on their favorite couch, with their dog or, something that makes them happy. And we're coaching the parent to be successful in doing the activities with their kid. We found, boy, that worked really well. And the therapy was going so much faster than when we were doing it in the office. And we still have in-office therapy too, for those who prefer that. But what I found is that we don't do every week, we do once a month. And the reason why we do once a month is that with Apraxia, it just takes a lot of practice. Practice, because you're developing those neural connections that aren't instantly coming together. But the first time you try something, it just needs repetition. And until it becomes an automatic skill. And a month usually is for the task that we give them is about the right amount of time before they've mastered that. And then we go to the next harder step and give them a month to practice. It's also a little less stressful to the parents because I said, not every day do you have to do it. Either, the kid can choose when they want to do it as far as what day they want off, or you find, as a parent, I'm just not feeling well, And so then you can find, if you get 5 days in for 15 minutes a day, you're doing great because skills will have developed. Even if you do 5 minutes at a time, a couple minutes a day, just those little parts throughout the day of doing a visual motor exercise can make a huge difference. And what we do is we teach the concepts to the parents, why we're doing what it is that we're trying to accomplish. And we're teaching it to the kid. We're talking to them. It's like,
Yeah.
I want to know, why am I doing this silly exercise? I don't really want to do that. But if you tell them the why, that this is going to make it easier for you to locate the letter on the letterboard, or like the patient I saw today, this is going to be helpful for you learning how to play piano, because that's really what she wants to do. She has a really big goal, and we're starting to where it is, and we're getting to that goal. And it's like, the reason why we're doing this exercise is because we want your right hand and left hand to be able to work at the same time. And so we give them that explanation, and then they're more willing to push through that challenge. And usually it's been taking, when we're concentrating on just the spelling aspect and communication aspect, it usually takes about 12 visits. It's really not forever, And after that 12 visits, and they're spelling and they're more efficient, and we're getting feedback from their practitioners and the parents, then they may want other goals. What else do you want to do? Are you done? Or do you want to keep working? Some of them are like, I really want to play pickleball. And okay. So let's develop those vision exercises in the motor for pickleball. And so it's a pretty exciting thing. It's very, very gratifying. And I get to see so many spellers on different parts of their journey, ones where they're just starting, to those who are typing independently and writing a book, and there's a lot in between that. And just their happiness, that they're appreciated, they're respected, we're presenting confidence, we know that they are able to do these things. They just need a little help to get to their goal. So it's pretty exciting.
I mean, it's the best work you could ever do. It's so rewarding. I mean, this group, this population is just an incredible group of people that have so much to teach us. And I just think it's fascinating. And I think what you're doing is so empowering for parents and for them as well. And, giving them the why is also, such a great way to empower somebody and help them to, have that own drive and their own motivation to go for it. And because it's work, they really, it's not easy all the time, and takes that challenge
to work with whatever challenges that their child has. And, it's my son too, when we're working specifically on getting him to the next level of his spelling. And he has very complex vision. He was meant to be my son. And so we got him to where getting through daily life, he's really pretty good at. Spelling is its own challenges, and keeping his eyes on the board and not just looking at it and then touching it, and then touching the wrong letter and looking away, but keeping the eyes on it while he's touching and getting that exact letter that he's looking for. So that's the part of fun, is developing strategies and, maybe color coding the letterboard, having a light against it. There's a lot of different things that we've done that I've learned from just learning the development of vision, and how can we, knowing that, how can we make these adaptations for getting them to that next step? And part of it is that I really want to teach other, not only parents and spelling practitioners, and OTs, we need to spread the word on how we can be part of that team. Really helping other developmental optometrists know how exciting it is to work with this population. It's not taught in optometry school. It's becoming a very big topic at all our conferences, because the rate of autism is so much higher that they're getting more and more of these patients in their chair. And they're like, what do I do and how do I do it? And that about a third of my time is spent doing lecturing at conferences and workshops and coaching and mentoring and doing consultation from doctors that are all over the world. I'm running to share everything that I have.
Yes.
And I sent him like a ton of information and whole protocols on how to do the exam and videos and that kind of thing, because I can't be the only one,
Right.
I'm very enthusiastic about it because it's my world, but I want to share that enthusiasm and really show how exciting it is. For me, it's more exciting than putting on a pair of contacts. Oh, good, you see 2020, see you next year.
Yes.
You really make an impact in their whole life and their family's life and their community, and there's no other job that's quite as good.
No.
Maybe your job is also great.
Yes. Yes. But this is really special because you're really reaching a group of people that, have not been able to communicate. For many of them are adults, and to be in a position to help them break through from that. I mean, and to be able to share what's been going on the whole time is life-changing for everybody involved. And it really is an incredible thing to witness. I've seen it myself with clients, and, it's incredible. It's like nothing else.
This show is brought to you by Therapeutic Approach to Growth. Therapeutic Approach to Growth helps families with relationship and behavioral needs. Their holistic programs are individualized to honor and respect each family and their autistic son or daughter's sense of self through programs such as relationship development intervention, naturalistic ABA, and animal-assisted services. If you're finding yourself frustrated or discouraged with your current behavioral programs and would like to see more long-term meaningful growth for you and your family, then contact TAG today at www.tagforgrowth, that's TAGFORGROWTH.com, to learn more about how to schedule a consultation or how they can offer you the help your family needs, whether in person, remotely, or in a school setting. Again, that's www.tagforgrowth.com.
Well, one of the things and you mentioned adults, a lot of my patients are getting their very first eye exam at 30 years old. And because their parents have heard about spelling, and then the spelling practitioners say you really need to get their vision checked because that's really important for their success in spelling. And the prevailing thought amongst most of the parents are, well, he can't say aloud the letters on the chart, and he can't do which is better, one or two, and make the selections of lenses. The cool part about optometry is that they don't need to say a word the entire time. We can do every single test in every category with reflexes, observations, different lights, different tasks, and we can check their prescription without them saying anything. Just like you see some babies that have glasses, they're not giving us, which is better, one or two. There's a technique that we do, and I just happen to have this here, that is Retinoscope, which is a light that I shine the light through the pupil at the back of the eye. The reflex bounces back, and I move my light, and I see how the light reflex moves. If it moves in the same direction, I add a magnification lens. If it moves the opposite direction, I add a minification lens. And when the reflex doesn't move, that means I've got the prescription. And so it's a technique that, I've honed over the years to where I'm pretty fast at it, because you have to be fast with this population. And it's, when you put the glasses on or show it in front of them, they're like, wow. Yeah. Because some of them have a very significantly high prescription. The rate about the research shown in just the autistic population, and not just the non-speaking, because that's a whole different category, but just in the autistic population, more than 40% needed glasses. 40%. Wow. And you figure, I would estimate that only about 5%, 10% of autistic kids have had an eye exam.
Yeah.
It's very little. And I get, the therapist and the teachers and the community that's working with these kids, they're like, how do I know when to refer the patient? And I'm like, every single one. Every single one needs an eye exam, because they have higher prescriptions, higher ocular disease, higher rates of visual focusing and eye teaming and all of that. And about, 50% of them in just the autism population have eye turns where they're seeing double. In the non-speaking population, and I'm working on writing a paper for this, it's about 80 to 90%.
Wow.
And that makes sense. If you think about apraxia, verbal apraxia, then they have all the motor, they have the mouth that works. The structure is fine. It's just the brain sending the messages to the mouth that are moving correctly and that's not able to produce speech. Same with going to the eyes, those little muscles, and there's 6 muscles around each eye and they have to coordinate just perfectly. That's hard. You know? And so usually when you see that speech apraxia, you're going to have visual ocular motor problems. And so if anybody gets anything from this podcast, it's to see a developmental optometrist and at least check that box that you have had that evaluated. And because the treatments don't take very long and can make such a significant change in their life. So that is a good thing.
Yeah, I love that you shared that. I think it's something I didn't know about until you shared that with me. And I think it's so important to have that awareness. With apraxia too, it makes sense. As you said, it just is something we just need to keep talking about. So, families have that on their radar to look into. It's a quality of life issue.
Until I learned about apraxia, which really wasn't until, even though my son had apraxia, did I learn about it? Not really. I may have heard the word, but I didn't associate it with how he moves through life, just the motor movements that he made that weren't intentional. They were either reflexive or impulsive movements. He wasn't necessarily in control of those. That's part of it. He's not in control of those. That intentional movement is what was delayed. They're like, well, if he can write, why can't he write and tell me what he says? If he can type and he knows where the letters are on the keyboard, why isn't he telling me things by typing? That's what I thought. I'm like, he can do both of those things, but he never communicated that way until he went to spelling. And that was always very confusing to me. And so I thought I went a few years without even bringing him to see Don Marie. And because I thought maybe he's not the candidate for spelling, because if he already knows how to do a keyboard and he can go through YouTube, no problem, and find the song that he wants and watch the favorite movie over and over and over, it's because those neural connections have been made because they were highly motivating and, to watch Barney or whatever he wanted to watch, highly motivating. And he was doing the same thing over and over and over again. So that neural connection was made to where it became an automatic skill. What we're trying to do is have more purpose with something that is higher cognitive and breaking it down to a very low motor demand. With spelling, where you're using a stencil to poke through, that's a very low motor demand because you're using your shoulder, not the fine motor like this. And you find, okay, with that low motor, I can do first a low cognitive task, like just spell toothpaste, and they can spell toothpaste, and low cognitive. And then you get to a higher cognitive demand, like, I'll read a story and you tell me, what's the story about? That's a higher cognitive demand. And then you raise the motor demand. Now we go from a stencil board to a foam board, where you're poking to letters. That's a higher motor demand. And you find then you have to lower the cognitive again. You're like a seesaw. You're building up those skills to where now you can do a high demand, motor demand on the keyboard with a high cognitive demand. So that's where the methods of S2C and RPM and Speller's method, they all have that similar goal of starting with a low motor and low cognitive and then moving to a higher cognitive, high motor demand. And and I'm there helping. They got the cognitive, but I'm there helping with the motor part, not just the eyeballs themselves, but the eyes guiding their motor abilities. So gives you a little idea of how that spelling system works.
Yeah, I'm so glad you shared that because I haven't heard it described in that specific way, but it makes so much sense. And it is like that seesaw. And it's, it's just it's a dance as you're going through the process, making adjustments. And, one of the things that you talked about when we met before was color therapy.
Yeah.
And I'm very curious about that, learning more about it and what that entails and what that looks like.
Okay. Yeah. And I would say 99.9% of people out there have never heard of phototherapy.
Okay.
That's what it's called, or photobiomodulation. There's a lot.
Heard of that.
No, nobody's really heard about that, unless you're a scientist or a developmental optometrist who uses syntonic phototherapy. It's not as widely known, but it's becoming more widely known. There's more research that is backing what optometry has learned even 100 years ago. That started about 100 years ago.
Okay.
In like the 1930s, So there was a doctor that way back then who found when looking through a colored filter that it changed how the eyes worked together as a team, how the eye movements went, and it changed how their nervous system was balanced. So, which was fascinating. And what a great tool to use for this population, because they have nervous system imbalance. They have difficulty with their eyes working together as a team and moving and focusing. So how it works in a basic way. In the color rainbow, red is a sympathetic nervous system stimulator. So sympathetic nervous system is fight or flight. And for parents that are listening to this, most of them have kids that are stuck in that fight or flight all the time. It's just their heart's racing, their pupils are dilated. You see these big, huge pupils, very light sensitive because they're in that fight or flight.
Yeah.
So if you give them red, the red will make them more fight or flight. So on the blue end of the spectrum is the parasympathetic stimulator, which is the rest and digest. So if they're in fight or flight, you give them have them look through color that is in that blue spectrum, and it shifts them further towards the balance, which is right in the middle, the green color. It's our happy color. Green is why we have the plastic plants that are green. It's the color that makes us happy, going into a forest. You see, the blue from the ocean makes us relax, And so we have these colors that are in our environment. Red stimulates that hunger and saliva and all that stuff, and gets us a little wound up and alert. And so you look at that spectrum of color therapy has been, a lot of interior designers have picked different colors in their room, depending on to have their work efficiency or to be able to sleep better, those kinds of things. But we use it in a way where we're using goggles that this one has a red color.
Okay.
If a child or adult is very low tone and you just can't get them going, the red is what's, and so you don't have to put them on. You can just hold it in front of them, but they look through it. And then we use a flashlight to shine towards their eyes, or just looking at a light, or just being outside. But they need light for the retina to absorb that color. And that immediately changes their nervous system. So when I try all different colors, and we look at the pupils to see how they react to light, and that can tell us which color is the one that's going to work for them. But usually the kids show us, right away. It's they may be very dysregulated, and I show them the color, and they're like, oh.
Wow.
Just so, and the parents are like, what are those? Can I bring them home? And I'm like, yes, you can.
That was my next question. Can they take them home with them, and can they have access to them?
And there's different modes to it. It's I can put it on a flashlight. They don't have to wear glasses. The glasses you can put on and the ambient light can be on. The flashlight, the lights have to be off to where this is only the color. We have like a machine that has the light color, and they just sit in the dark room listening to their favorite songs on the music or being in silence. We work on their breathing while they're looking at the light, and it makes such a difference. And so we start the therapy always using color therapy, and then we do the harder, challenging things. And then as we get to the challenge, we may do the color at the end as well. So we get them, relaxed, riled up, and then relaxed.
Yes.
And then it becomes to where those activities are just relaxing.
Yes.
And that's the goal. We don't want them to be anxious every time they do an eye movement. We want them in a relaxed state to do that.
Yeah.
So that's what's pretty cool about color therapy.
Oh my gosh. That makes so much sense. Isn't you're conditioning the body to relax
Yes.
when these activities come out?
Yes.
Activities promote relaxation.
It was like, oh no, they're going to make me do something that's hard.
Yes.
We want them to have that opposite effect. It's like, I can relax and cross my eyes.
Yes.
Do that instead of going, and crossing my eyes and getting that anxiety to it. We want to be able to do in anything that's hard in a relaxed state.
Mm-hmm.
And you can see why that transfers over into everyday life. And, in the exam, we have all handheld equipment. I can do the exam on the floor, on the trampoline, on a swing, next to the garbage can, wherever the kid likes it. By a wall, they can be standing, jumping, it doesn't matter. The exam doesn't have to be in a chair, because, I would say the majority of them are not comfortable with sitting in a medical looking chair,
Right.
So even my office looks like a living room out there. It doesn't look like a medical office. And so we often do the exam out there or outside, so I have travel. I have it all in a box and I can travel.
Yes. I love that. I mean, it just makes it that much more effective, to get the information that you really need. And it makes a lot of sense. And for families, I know families will travel to you. They'll come and do their eval with you there, and then you can work with them remotely, right?
Yeah.
Through this program.
And there's different ways that we work with remotely. I'm licensed in California and Arizona and Georgia, which sounds weird, right? That I have Georgia, but there is a large group of spellers in Arizona and Georgia. Because we have a lot of spelling practitioners in those areas. And so they convinced me to get licensed. So I do travel optometry too. I bring all my equipment in suitcases and go to Arizona and Georgia, do a lot of evals, and then I can do online vision therapy for those who live in those states. For those who are outside the states, I can do consultations with the parents. I can't do direct VT because that would be practicing without a license in their state. But usually I try to connect them with another optometrist that is in their area, and I consult with the optometrist on here's all the things that I found in the exam and kind of the protocol of activities that I would do, send them videos, and and they have their own repertoire, and I get a lot of ideas from them too. But then they don't have to start from scratch. They kind of know about the kid from my report, and then that consultation really helps. And then I can mentor them if they need it. I've done that with hundreds of doctors, done from around the world. I just did one in Barbados, and then Vietnam, and one in Czechoslovakia, and there's spelling practitioners that are starting to pop up all over the world, and so they're calling me too. They're calling me. They're not calling me because I'm hearing impaired. So we Zoom, or I do email. That's been really working well.
Incredible. I mean, you're just reaching all around the world. It's incredible.
Yeah.
And it's going to continue.
Before I can't practice anymore. I have I'm going to be, in my little walker, 90 years old, still seeing patients now. By that time I'll have some younger doctors that will be doing it, and I'll just be consulting. But I don't see myself ever retiring, because this is just it's what I was put on this earth for, and have this purpose to help these young women and men to have a fulfilling life,
Yes. It's huge, huge. And, I'd love to have you share kind of before we wrap up, just what kinds of differences do you see when they're spelling before and after vision therapy or this work that you're doing specifically for this?
Well, and I'll take the young woman that I just saw this morning because she was right fresh in my mind. When I first evaluated her, she had a very complex vision to where one eye was nearsighted, one eye was farsighted with astigmatism. She had one eye that turned up and out, so she saw double like this. Her eyes couldn't move in one direction, only could move in the left direction. So she had postural changes, trying to look like this. And everybody tried to straighten her out, and then she'd go like this because her vision was guiding her posture. So we did, and she had that restriction of gaze. So things would be scary if somebody came off from that right side. She'd have to move her whole body to see them. And this is not an unusual case. This is pretty common of what I see. And she had been to other eye doctors, but they just figured that since she wasn't able to speak, that she couldn't do the traditional things that we do in the office. It is out of the box, trying to do that. So we did some activities where, she had glasses that, was the first part that we used some prism. Prism is a type of lens that looks, like this. It's a prism that goes in front of the eyes, and a prism just moves an image. So if she had prism going up and down to bring the images close together and then side to side to bring them together. So that was the first part we did with glasses. Then we work with each eye, trying to get the eyes to move in different directions. So we would do like high fives and stick in the straw. My favorite activity is a straw with a stick. Yeah, and it is like very cheap vision therapy because they're motivated to put the stick in the straw. Like every patient to put the stick in. And you need depth perception to do that. And you can do it with one eye, but you really have to really work and hone in to put that stick in the straw. And we may put first, a straw in a tube, if their vision is too difficult to put the stick in the straw. So we did that in different gazes to get the eye muscles to have full flexibility with each eye separately. And then we did a lot of body control activities where she was having to move her arm in a controlled manner, hitting a ball on a string, jumping on a trampoline, hitting a ball on a string, because you're now having to judge movement and depth and be able to alternate each side of the body. That's what we are working up to. And we started with what looked very simplistic things, but were very, very hard for her. And now it's incredible what she's doing. We've worked together, I think, 12, 13 visits. And now she's looking at a paragraph that has nonsense paragraph and taps the A, then the B, then the C, then the D. And she is so accurate with it. She is playing different sports. She's jumping and tapping with prism glasses and doing things where it has a cognitive demand to it. And, and it's incredible. Changed her life. Changed her life. And her spelling is just, it was very, very difficult for her to use any board when we started. And now she's becoming so much more accurate. And, what's interesting too is that this doesn't happen with all of the patients, but because you're with the spelling and you're stimulating that language center, right? Their speech is getting a little better too. You're getting the global apraxia where you're getting more control of your body, the small parts with the mouth. And so a lot of them are going back to speech therapy as well for the articulation, but still having that outlet of communication through spelling. So and that's what's happening with her as well, which is pretty cool. So we use a lot of different tools, fun tools like pulling, and because that's working on strength and the grip and the reflexes and primitive reflexes, all different things, to pretty sophisticated type of lenses like yoke prisms. People have heard about those that can line up the perception of where they find the middle of their body to their actual middle of their body so that they may not be toe walking anymore. Toe walking big thing that we work with in the office, because that toe walking can be a physical thing. It can be a sensory thing, but it also can be a visual thing, to where if their perception of their midline is, if their horizontal midline is down here, they'll be leaning forward onto their toes. And so we put a prism on. It changes the perception of where the floor is, and then their feet go more flat.
Wow.
The younger you take care of this, when they're 2 and 3, and the faster it goes. But when they're older and, they have some tightening of their Achilles. So I work a lot with OT and PT, with stretching and casting and stuff while we're doing the exercises with the prism glasses. And for so many of them, they're able to have a normal gait after that, which is incredible,
Incredible. Yeah. I mean, that's a whole nother topic.
I
know. I'm fascinated. I love it. Wow. Amazing. Well, you're doing incredible work. I'm so glad that you're able to share all this, and I'm excited to share it. I know with my audience and my own clients, and I know we'll definitely be working together at some point, because I have many clients that we want to have access to your support. So thank you so much for all this wealth of information and everything you're doing for the community. And, I'm excited to see what your future looks like, because you're going to be just getting bigger and bigger as people learn about you.
And I should mention too, if you happen to be listening to this and you're in Nebraska or New Jersey or whatever, they do have a website of those who are developmental optometrists, and it's the College of Optometry and Vision Development. They've recently changed their name, but the reason why I say that is that their website is still www.covd.org. And there's a location of doctors that are near you. And, I'm welcome to, if they want to email me, any of your listeners to email me, and I can make a referral of people that I know in those areas, because I know a lot of the doctors, we're a very tight community.
Yeah, good.
Met each other over conferences and that kind of thing. I'm connected, and because a lot of our kids can't travel to California,
yes.
So we want to get them, hooked up with the right practitioner.
Yes. Well, we'll make sure to include that in the show notes. And also, how can people find you?
Yeah, so I have a website, susandanieloptometry.com. Pretty easy. And then my email is susan.danieloptometry@gmail.com. And I don't even have a phone number, because I'm not here. So don't try to call an office. That's not mine.
Okay.
Just email me or look at the website. It'll lead you to me. So.
Perfect. Fantastic. Well, thank you so much, Dr. Daniel. This was such a great conversation, and we'll include all of that information in the show notes as well, so people can find you. And I just appreciate you being here today. Thank you so much.
Thank you for the opportunity.
I'm dancing on the edge again. The wind is calling my name. I'm dancing on the edge again. This time I'm not looking back, babe. You can change me, you can tell me down. I'll leave echoes in every place I find. I'll break the molds with the rebel's mind. I'm a hurricane of free born mind.
The information provided on this podcast is for general informational purposes only. The content shared is based on the experiences, opinions, and perspectives of the hosts and their guests, and should not be construed as medical advice, diagnosis, or treatment recommendations. The discussions and topics covered are intended to foster understanding and awareness of autism therapies, but are not a substitute for professional medical guidance. Before making any decisions regarding therapies or treatments, we strongly encourage you to consult with a qualified healthcare provider who can provide personalized recommendations based on your unique circumstances. By listening to this podcast, you acknowledge and agree that the hosts, guests, and producers are not responsible for any consequences, damages, or outcomes arising from the use or application of any information during the show.